Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele van Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 71, Insights into MS Treatment in Colombia with neurologist Dr. Adriana Casallas Vanegas. Dr. Adriana Casallas Vanegas is MS neurologist at the MS Care Center and an ECF fellow, so European Charcot Foundation fellow, and works at the Clínica Nueva in Bogotá, Colombia. And now enjoy the interview. Hello, Adriana. It's such a pleasure to have you on the show, and hello to Bogotá in Colombia.
Hello, thank you so much for having me, and congratulations for this amazing initiative to highlight demyelinating diseases, and thank you so much for this space.
Thank you for being here and being my guest. And before we actually start with the interview, it would be lovely if you could introduce yourself to the audience so they know who is with me on the podcast today.
Of course, my name is Adriana Casallas. I am a neurologist from Colombia. I'm a specialist in demyelinating diseases. I was studying sometime ago in Mexico and in Spain to prepare myself to attend in the best way for the patients. Currently, I'm ending my study in the multiple sclerosis master at the European Charcot Foundation, and as soon as possible, I will go to the Cemcat to start the ECTRIMS fellowship this year. I live maybe 1 hour away from Bogotá. This is the capital of Colombia. I have 2 dogs, 2 sisters, and my dogs are named Bubba and Tango. I love and I enjoy to spend time with them, walking, biking. My dog Bubba plays tennis, so I really enjoy life with the pets in general. I'm come from a loving family, always surrounded by pets, and I enjoy to learn all days new things and explore different traits. So I'm so curious about literature, technology, sports, and I love to enjoy life.
That's good. And it's, of course, always good to learn new things. Lifelong learning is something very important, I think, and it helps us patients if you get more and more known with the demyelinating diseases. Of course, we are happy that you are doing that. And what was your personal motivation for your career choice?
Well, ever since I was young, I have enjoyed interacting with people in general, working with people. And the idea of being able to contribute to society is one of the main motivations for me to study medicine and to study neurology. So I decided to pursue a career in neurology because I have a strong passion for neuroscience and the study of the central nervous systems and the brain's function in general. During my specialization in neurology, I became so fascinated with demyelinating diseases. I met a patient with multiple sclerosis, and I just fell in love with the disease, with the pathology, physiopathology, everything. And I felt like it was opening the door to a new universe, a new world of knowledge and opportunities related to the development of medications and strategies to preserve neurons to improve the patient's quality of life. So I think I have a big passion in multiple sclerosis and related disorders. And now I think that I'm working to make dreams come true. Because nowadays I'm working in a multiple sclerosis unit, a multiple sclerosis center in Bogotá. And I confidently can say that it is the best professional decision of my life.
Sounds good. And let's come to some facts. So what is the prevalence of MS in Colombia, and how many people receive a new diagnosis each year?
This is an important question because we don't have a lot of studies regarding prevalence and incidence of the disease. But in general, in Latin America, the prevalence are increasing in several or large countries and cities. For example, Mexico City or Buenos Aires are good examples of the increasing of the prevalence of the disease. Theoretically, Colombia has been known for its low prevalence of MS, leading to the classification of multiple sclerosis as an orphan or a rare disease conditions. Our data is reported by the National Institute of Health, that is our particular health institution, and reveal a total of more than 4,000 patients diagnosed with multiple sclerosis between 2016 and 2022. But the prevalence can change if you see one region, if you compare with another. For example, in Bogotá, you can find a higher rate than in other departments as Nariño, Antioquia. It depends of the region. We are working in trying to reveal more precise data on prevalence. We are conducting a new study here in Colombia, and it presents unpublished data that you can find 8.2 cases per 100,000 inhabitants in Colombia right now. But maybe 10 years ago, it was 1.4 or to 4.8. So it's a huge and big difference between those data. And maybe it reveals that we don't have previous data from the government about prevalence and incidence of multiple sclerosis, or we have a small sample size of the studies, or limited data, or limited access to the populations to healthcare centers specialized in demyelinating diseases, and maybe we are misdiagnosing or not reporting the new cases in Colombia. So I think that it could be a big opportunity to close this gap in knowledge and data here in our country.
So maybe 10 years in the future, it will be a higher prevalence as well. It might go up even further, right? Okay, so you just mentioned that it is a rare disease, at least for the moment in Colombia. So how aware is the general population of multiple sclerosis?
I think that we are doing better day by day, but we have still a lot of work to do in this particular point, highlighting demyelinating diseases. For example, we are celebrating the World Rare Disease Day every year, and we have some specific and particular laws that can highlight these needs of the patients to get more involved in educational programs, in orphan or rare disease in Colombia. I think that Colombia is so diverse. We call it in some specific situation the normal Colombia and the deep Colombia. We can find highly educated individuals in urban areas and lower literacy in the rural regions. It can be maybe a difficult position for the patients and for the general population regarding education and knowledge about the demyelinating diseases. So diversity presents challenges in accessing to information and health services as well. So regarding this particular point, I think that we are getting better in knowledge, but we have a lot of work to do. Trying to cover all the questions, try to cover all the gaps in knowledge.
Yeah. So you already mentioned health literacy, but what are some other challenges faced by MS patients in Colombia regarding access to healthcare and support services?
I think that the quality of life of Colombian MS patients has not been fully researched. We have some studies in quality of life that indicate that they are so well, the quality of life is fine, but we think that we don't have a lot of complete information or up-to-date data to give a particular on a specific good prognosis in quality of life around the disease. We have a lot of lack information, so I think that this is one of the challenge of the patients in Colombia. But not only the patients, even the healthcare professionals, policy makers, they have a lot of issues understanding and addressing the specific needs of the multiple sclerosis patients. That's why I think that those spaces are so important to highlight that we need a lot of knowledge in multiple sclerosis regarding the needs of the patients and the disparities, the lack of follow-up, the difference between the public and the private system, health system, the difference across the availability and the access or the opportunity of access or on treatments in multiple sclerosis. So I think that we need as healthcare professionals, but I think we have to give voice to the patients. I think is another challenge for the patients in closing this gap to know what the really patients need in the multiple sclerosis situation and the multiple sclerosis world.
So which cultural stigmas or misconceptions exist surrounding MS in Colombia?
I think that one of the biggest problems is this gap in knowledge, that this insufficient understanding of the disease has led to numerous misconceptions among both the general population and, again, the healthcare professionals. One common misconception is that the multiple sclerosis results always in severe disability, which can profoundly impact the family planning, dreams, work, life plans for the patients. And if we do good work, if we can identify and treat earlier the disease, maybe the history is completely different. So I think that this is the biggest stigma for the multiple sclerosis disease in general. I think that in Colombia, we have a particular issue related to work. Patients may face rejection and be pushed into different work settings, leading to feelings of inequity or inequality. This can result in social isolation, loss of income that is so important for the family planning too, and disruption of the family life. This is important to highlight because multiple sclerosis tends to affect more young people in productive and reproductive years, and it has a significant impact in the overall quality of life. We are facing to a particular situation with some special populations, for example, indigenous population, where the access to MS treatments may be limited, or and the cultural beliefs and can influence the decision of the treatments and the access to the traditional medicine or healthcare.
Yes. And maybe, I don't know if you can dive a bit deeper into how do the cultural beliefs and attitudes affect the treatment and management of MS in Colombia?
For example, you can find some persons and populations that don't believe in the monoclonal antibodies, so they believe there is different for them because of the religion, or expect to be cured because of miracles. And you cannot fight with the culture, but maybe our most powerful armament is the education. So I think it could be a good opportunity to change that panorama.
Yes, and hopefully, I mean, here in let's say in Germany, in Europe, of course, we also have people who have certain thoughts about how healing could happen. But if it could come together, it would be perfect. You know, if you use the monoclonal antibodies and you use your spiritual leader or whatsoever, this would be perfect. If it's just combined and not one or the other, because I guess the belief in something can help as well. If you believe strongly in, it's possible to have a better life when you do certain things. It doesn't have to be one or the other, as long as it's not harming. But yeah, not so easy with the cultural beliefs. Okay, so you already mentioned a little bit the access to treatment and support services. What types of MS treatments, therapies, or interventions are more commonly recommended or accessible in Colombia?
Well, in Colombia, we are so privileged country in Latin America. We have access to all the treatments available in multiple sclerosis, including first-line therapies and monoclonal antibodies, oral treatments. The Colombian health system comprises a large social security sector that is funded by public and private resources. There is a contributory regimen for individuals with the media to pay, such as those with employment contracts, and subsidiary the regimen for people living in poverty or vulnerability. It is like a universal security system that gives priority special populations, including displaced, child, minorities, indigenous, and some particular individuals in protection centers or rural populations. But even this difficult panorama, the healthy system can cover almost or more than 90% of the population in Colombia. All the patients, in case of relapses, can be treated with steroids, or even if they need a plasma exchange, it is possible. With autologous hematopoietic stem cell transplantation, it is not commonly performed in Colombia, but it is available in those specific cases where there is no response to conventional treatment. So we can do it as well at the hospital, in the hospital or in the clinic. We have a lot of point of view in multiple sclerosis, because we try to manage in a multidisciplinary way. In the context of the rehabilitation, I think that this branch of neurology and neurorehabilitation has garnered significant attention in recent times. The health services now offer a range of rehabilitation approach that are tailored to the particular needs of the patients. We are trying to see the patient as an individual, but not alone. And the individual view, it is not a unique view. We need a multidisciplinary team to try to get the needs of the patients. I really believe that this specialized approach is a critical point to enhancing the overall quality of life of the patients. And I think it's available, rehabilitation in the multiple sclerosis centers in big cities in Colombia, not in the rural area. So again, we have a lot of work to do.
Yes, but I think that's an issue in all countries. So it's not so easy to find somebody who is well known and does do the best physiotherapeutic approach in rural areas in Germany, for multiple sclerosis. So I guess that's an issue everywhere, which we have to fight, and where probably tele rehabilitation and other things might help in the future better, hopefully. Are there any specific laws or regulations in Colombia that protect the rights and promote the well-being of individuals living with MS?
Yes, being an orphan disease in Colombia, they are protected by law, which means access to pharmacological treatment, governed by clinical guidelines. This model seeks to eliminate access barriers to care and improve timely diagnosis and treatment through more efficient management by insurers and health providers. There is a specific law in the Colombian constitutions regarding rare disease, and the patients can ask for government support, financial support in particular cases too.
Okay, that's nice. How do MS patients in Colombia cope with the challenges of living with the condition?
I think that in Colombia we have some extra help, and it's because of the patients' associations, as ALEM or Fundem, that play a crucial role in providing care of an extra care of MS patients. These organizations offer specialized care and legal guidance to patients who may be needed. In addition, they play a significant role in educating and promoting social inclusion for patients, MS patients and their families. They are valuable sources of information, academic and recreational, and sometimes and in rehabilitation support too. We work a lot with those associations because it provides another space, not just a clinical space to share with the patient. So I think it's important to highlight the labor.
Fantastic. You already mentioned the social support networks. Are there any additional community resources that play a supporting role for MS patients in Colombia?
I think that the same patients associations, but there is some effort in academic activities and recreational activities and comprehensive care. But I think this is the same figure, and they are providing opportunities to share experiences and enjoy living with MS.
Fantastic. You already mentioned that there are quite some strong beliefs and religious, let's say, things, conditions. So how have healthcare providers in Colombia adapted MS management strategies to better align with the cultural norms and preferences?
Yes, I think this is a challenge, but the Colombian health system has been continuously evolving to meet the needs of the individuals or the patients with multiple sclerosis. That includes providing comprehensive care that not only focuses in the patient but in their family. The approach encompasses continuing education initiatives and emotional support programs, which are customized to align with the specific beliefs and cultural nuances prevalent in different regions of the country. To understand every epidemiological aspect of the population, it's important to get closer to them. Moreover, this holistic strategy is underpinned using clinical guidelines that have been specifically endorsed for the management of the multiple sclerosis patients in Colombia. But I think that to know the population gives you like a superpower regarding closing these gaps.
Mm-hmm. So let's talk a little bit about the Multiple Sclerosis Management Master Program. That's why actually I know you, because we had 2 or 3 classes together with the German Masters Program. Why did you choose the Multiple Sclerosis Management Masters Program that is offered by the Charcot Foundation?
Well, I have to say, I have to confess that I always dream about a multiple sclerosis master, but it didn't exist. When I came and I have a meeting in the European Charcot Foundation Congress in Baveno, I for the first time I heard about the multiple sclerosis program. Then I was so determined to apply to the program and to study with the European Charcot Foundation. So thankfully I took the initiative, and I was so blessed because I have already this opportunity to be involved in the multiple sclerosis program as a student. Right now, I think it's a wonderful experience, and I am learning with the best. I'm with the leading experts in the field, and all we share the mission of getting better in advanced care for the individuals affected by multiple sclerosis. I think that this experience has not only been academically enriching, but also it touched my soul. Is so important for me because I think that I'm learning for my patients. So I think it's the most important thing.
Yes. So what new or in-depth things have you already learned about multiple sclerosis that will benefit your patients? Can you maybe share 1 or 2 things?
Yes, of course. I really believe that the concept of the multiple sclerosis care unit, it represents a unique holistic approach for the multiple sclerosis management, viewing the patients in a complex and more integrated point of view, not just the individual, but the family, the social connection, the work aspirations, personal beliefs. I think this comprehensive perspective ensures that care is not only multidisciplinary, but for me, and I think that for all of the multiple sclerosis master, so deeply empathetic, addressing the complex need and emotion of the patients. But I think that recognizing this interconnectedness of all aspects of the patients is an amazing approach that significantly improves the quality of life, highlighting the essential role of the empathy and love and passion in the clinical practice.
Yeah. How do you benefit from the international exchange with the lecturers and other study participants? Because I think there are people from Europe and there are for sure lecturers from, I think, Japan, and your experience is even much wider than ours. Ours is more or less the German-speaking countries.
First of all, I'm learning different types of English. But,
yes, true.
But more than that, I'm sharing with people from all over the world. And I think that it gives you a more comprehensive vision of the pathology. I learn about different strategies in each country, access to treatments, sharing complex cases helps us to gain experience and have more global perspective to help the multiple sclerosis patients. But on the other hand, it's very pleasant and for me it's wonderful. It's amazing to share experience and to have friends with whom to live and make dreams come true. I think it's amazing to think and to see in the same way.
Okay, yes, absolutely. Let's talk a little bit about gender disparities in multiple sclerosis. How do gender disparities manifest in the field of multiple sclerosis research, particularly concerning representation in leadership roles?
Yeah, I think it's a big problem, but fortunately we are highlighting this specific topic because it has become increasingly evident that there are gender disparities in academic medicine, in neurology, and the multiple sclerosis research. Women are less likely to participate in collaborative publications, and historically have been underrepresented as first or last authors in publications and in clinical trials sponsored by the pharmaceutical companies. There is recent data of the ANE that reveal a significant gender pay gap in neurology comparing even with other medical specialties. Mm-hmm. So I think it is important to talk about it because neglecting the role of the women in academic leadership positions results in reduced visibility and recognition of research in multiple sclerosis, which can hinder progress in understanding causes, treatment, and outlook of neurological disease, including, of course, multiple sclerosis, especially considering that it's 2 to 3 times more common in women. So we are living with multiple sclerosis, but we are not actively participating in all the academic roles that we can for sure do it.
Yes, and it's something that is very interesting to me because I'm a woman, I have 2 daughters, and I want to see some change in that direction, hopefully in the future, hopefully for my girls when they grow up. What strategies or initiatives can be implemented to address these gender disparities and promote more equity in the future?
I think the first step is to recognize this gap or this difference. For example, in many Latin American countries, there is a lot of reasons for the gap between men and women in science. One of them include some types of discrimination or gender stereotypes, social expectations, self-esteem, gender roles, family planning. So the crucial point is to measure and highlight and recognize this gap to act on it. I think that the better initiative is to work to highlight this specific topic and the International Women in MS are working to support and train women in clinical practice and research in the field of MS. Also, the pharmaceutical industry, academic leaders, editorial committees, and scientific society needs to consider both women and men equitably in their policies or in directive work and the university too. I think there's a lot of efforts are being made to close this gap. For example, here in Colombia 10 years ago, there were no women in leadership positions in the field of MS, and to date you can find maybe 10 young and so well-prepared women leading this fight. This is a step towards creating a fairer environment in neurology in our country. I think it's good to talk about it, but it's good to work against this difference.
Absolutely, yes. Both steps have to be done, or both approaches. Yes, talking and of course doing, not just talking. Okay, so let's come to the quickfire Q&A session. Complete the sentence. For me, multiple sclerosis is.
Is my purpose in life. Is my passion. Is the reason why I want to learn and to work day by day.
Yeah. What development would you like to see in the field of multiple sclerosis in the next 5 years?
I deeply dream about advancement that will lead to a cure for demyelinating diseases in general, bringing hope to MS patients and fostering closer connection between healthcare professionals and persons living with MS, assuring them for constant support. And in the other hand, I think that having a better understanding or knowledge about the physiopathology, it's so important to impact, for example, the invisible symptoms that are those so disabled in the patients.
Yeah. Okay, so finally, what message of hope or encouragement would you like to share with individuals living with MS in Colombia?
I really want to express my gratitude to Colombian patients. I think that their invaluable contribution is pivotal for advancement of treatments, knowledge, and strategies aimed to improving comprehensive management. I think that their strength and patience are fundamental to the progress of science and the quality of life of them. I want to emphasize that they are not alone. We are with them. We are together, and together we can achieve remarkable results. So lastly, I want to instill a message of hope. Although the journey is long, we are committed to triumphing hand in hand. So thank you so much for this inspiring work that the patients give to me.
Fantastic. Yes, thank you. So, Adriana, how and where can interested people follow your research activities?
You can follow my Instagram, Doctora Casallas Neurología, and also you can find the research and the MS activity on X platform, HCV Adri.
And of course, I will put these links into the show notes and the blog articles, so you listener can click there and don't have to do the search. You just need to look into the show notes or the blog article. Adriana, it was such a pleasure to have you on the show and to learn a bit more about how it is to live with MS in Colombia and how treatment works. And I hope to meet you in the future in person. I think I missed our chance in Milano, in Milan. But yes, it was so crowded and it was so interesting and so much interesting stuff going on. And I don't think I will join Copenhagen due to my little baby, but maybe then the next one. I don't know where it will happen, but maybe we will meet there. So thank you for everything you are doing. Thank you for everything you are doing for the patient community and for better treatment. And yes, I would love to get to know Colombia in the future at one point, maybe in a few years when my little ones are a bit bigger and are okay with such a long flight.
Thank you. Thank you for having me. Thank you for your work in highlighting demyelinating diseases and unmet needs of the patients. And of course, you are so welcome in Colombia. It's a long flight, but I think it deserves it.
Yes, I think so too. I've seen so many beautiful pictures, and I listened to the birds in the background during our interview. I always heard them singing. Very lovely. So thanks and bye-bye.
Bye-bye.
I hope you enjoyed the interview and got some insight into the treatment and care in Colombia. By the way, next time it will be another episode on immunotherapies, and this time it will be all about natalizumab, which is known as Tysabri or Tyruko. So please tune in again, recommend the podcast to who might be interested in it, and rate it wherever you listen to the podcast, and see you next time. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.